Well, hello everyone, and welcome to the Living Well, the Ultimate Health Journey. We are Angel, myself, Jovi, Dr. Zinni, and one of our beloved hosts who is not here with us, Alice. And we are here to bring you a wellness talk on injections and vaccine injuries and everything that involves around that. So, without further ado, um, thank you so much for being with us, Dr. Zini, for being our honorary doctor amongst us, helping us to live our lives in a healthy way in every way. So, we're looking forward to this talk on vaccine injuries and everything that's entailed with it. Over to you.
Thank you. So, I guess to start off, there's a little bit of a disclaimer in that there is so much information out there. It would take us hours to go through it all. So this is going to be kind of like a high level overview, or maybe kind of like an awareness to kind of pique your interest, and then maybe you can dive in deeper um, later on your own. But this will be more like an awareness. So first of all, the good news is that the vaccine, although there is a lawsuit out there that is saying that it's not really a vaccine, but that's a whole different topic. Anyway, the good news was the vaccine did a great job in that it told your body to make a spike protein against the virus. The not so good news is that because of the way it was engineered, it didn't really seem to have an on-off switch. It was kind of like switched on all the time. The other not so good news about that aspect is that it created what's called a locked-in phenomenon, which means that everything kind of looked like this one specific virus. So it kept on churning out these antibodies, which was called the spike protein, against anything and everything. And that's why people developed this hyperimmune response, which means that there was a point where it kind of overload and then turned itself kind of against the body. And now it started recognizing the body as a foreign agent and started attacking the body. And that's part of the autoimmune response. So you can imagine if you're in a war and you're the good guys and you're in a battle, you don't want to start shooting your own good guys. You want to shoot the enemy. But that's what's happening with the body, is that the body is kind of self-destructing and shooting itself. And that's how we come up with some of these injuries um, where the body is kind of not only injuring itself, but now you have a impaired or a dysfunctional repair mechanism. So not only you're injuring yourself, but you can't even repair itself. So that just sets up for a whole cascade of events throughout all the organ systems. But tonight we're going to concentrate a little bit about the cardiovascular system because that's the one that's in the press the most. That's the one that's been seen the most. So we'll concentrate a little bit on that aspect. Sound okay?
Yeah, that's perfect,
Awesome.
Dr. Phillip.
Yes, thank you so much for that introduction. So, right now we have time for some questions. Um, so, Jovi, would you like to ask our first question?
Yeah, actually, I have someone in the audience, Dr. Phillip. They're asking, what does spike protein mean? Especially what you were just mentioning right now.
Yeah. So the spike protein is a specific antibody that is meant to go after the virus, and it kind of looks for um, the little spiky thing that comes off the virus. The reason why it's called coronavirus is because it's round and it has these little spikes off of it. Corona means crown in Latin, so it kind of looks like this little crown, and that's what the spike protein was to go after that aspect of the virus. The problem with that is it literally is a spike. So as it's going through the cardiovascular system, it's bumping against the walls of the blood vessels, it's nicking them, it's injuring them, and that's creating a pro-inflammatory response, which means that the body has a harder time to heal, and it makes the body more prone to other injuries like clotting.
Oh, wow.
That was a very good question, Jovi. So to piggyback off of that, we have another question. Do our bodies have their own spike proteins that develops?
So, yes, when a person naturally was exposed to coronavirus, their body would make a naturally occurring antibody that had the spike protein. But the big difference was that when you got the vaccine told your body to make the spike protein antibody, don't stop. Whereas when your body natural immune system comes into play, it sees a rise and fall of the enemy. And as it sees the enemy kind of dwindling off, the, the production of the antibody slowly dwindles off. So that's why in typical vaccine worlds, when you get, for example, a tetanus vaccine, your body develops antibodies based on the vaccine, but then after time, it wears off. So you need a booster. Same thing with your immune system. Your immune system would develop an antibody against a coronavirus. However, because this antibody could potentially cause some injuries, that's why some people would develop something called long COVID or COVID type symptoms for a prolonged period of time.
Wow.
This is this is some heavy stuff because your health is everything, and just to think about like how something that you wouldn't think is will cause so much damage, like that's a little scary. But thank you for that. That brings us into our next segment about the different um, um, conditions that you can have when you get these vaccines.
Sure. So the big ones that are in the cardiovascular system, which just means the heart and blood vessel system, the big one is clotting. And how it really came to notice, it's kind of morbid, but how it came to be noticed was on autopsies. And the morticians were trying to embalm people and they couldn't because the veins were literally plugged up and the arteries were literally plugged up. And
Wow.
they would pull out these long, the longest one I saw was a 3 foot clot. And then they started putting everything together and saying, so what was the commonality in all of these individuals? And it was the vaccination status. So that was the first thing that kind of cleared them off or led them into it and gave them a clue. The second thing was we started doing blood tests, and the blood test saw normal markers of inflammation within the blood vessels that were higher than normal, and not only higher than normal, but it's like this shouldn't really be that high. So there's something called HSCRP, which stands for highly sensitive cardioreactive protein. And usually in someone that has maybe high blood pressure, high cholesterol, that may be like 2 or 3, or maybe at the very most 4, but we're starting to see them in double digits. And then we do something that's called a troponin level, which is an acute marker of inflammation, like when someone's having a heart attack. And we're seeing those in the 2 and 300s. And this is a relatively healthy person. They don't have high blood pressure, they don't have high cholesterol. So, what else is causing it? And then you trace things back, and we find out that they've been vaccinated. And the more vaccinations, so that means the initial 2, and then a booster or another booster, or I think the last time I counted, there could have been as many as 6 boosters. Um, the more boosted an individual, the more prone they were to that. So all that created this irritation and inflammation within the vascular system that caused these clots to start forming. So that was in the blood vessels. And then we noticed that within the heart muscle, which is probably the most vascularized organ of the body, we started noticing that the immune system was attacking not only the muscle itself, so that the muscle couldn't work as well as it could, causing things like congestive heart failure, but also was irritating the lining around it. So the lining around it is called the pericardium. So you would have pericarditis. Itis is just a fancy word for inflammation, or myocarditis, which means the myometrium, or the muscle itself, was being inflamed. And that's what leads to the congestive heart failure. And I just saw a gentleman today, young guy, didn't have any other issues except for he was vaccinated. And now he's on multiple drugs for the congestive heart failure. So now we have to start kind of going into mop up and cleanup, and how can we help these people? And that's where mainstream medicine still quite isn't there yet, but at least they're recognizing that there's an issue, and the public at large is starting to recognize that. My next door neighbor was 40 something, seemed healthy, was out walking his dog, and then he had a heart attack. So people are starting to notice that something's not right.
Yeah, I myself, so I, can't say this definitively. However, I had a friend who passed now. However, after she's a nurse, she's a registered nurse working in a hospital. After she got the COVID vaccine, months later, she was diagnosed with cancer,
Mhm.
and now she's passed. However, she couldn't help but think that it was linked to getting the vaccine.
Mhm.
Um, and so I think it's crucial and important to not sweep it aside, but find out everything you can about it, because you don't know how you are going to react to something at the end of the day. And so this is just something that I want to encourage everyone to do, including myself. Ask questions, keep asking questions. um, don't just settle on one or two or three people telling you something, right? Because your health and wellness is worth it. So that brings me into another question that we have for you, Dr. Zinni. And the
Mhm.
question is, um, do okay, I'm gonna word this correctly. um, do you have a can't really think of the word, like some sort of test to be done um to help you figure out your risk factor for, you said, myocarditis and pericarditis, and what are those tests?
Yeah, excellent point. So there are tests out there. They're more in the research world to look at the level of spike protein that's in the blood. Unfortunately, that's not available to us in the trenches. But what we can do is we can look at, like you said, markers. The first one is that one I mentioned, the HSCRP. That's a really easy test that anyone could get. I mean, any physician can order. The next one is the troponin level. That's another one. And then the third one is called D-dimer. All of those look at inflammation within the vascular system. So what I do that's a little bit different is that I also do other simultaneous tests, like something that's called a SED rate or ESR. The SED rate looks at inflammation in the body, but it's more geared towards musculoskeletal inflammation. So, like if you have osteoarthritis, the reason why I get that is that if someone's vascular markers are really high, and then I get that SED rate, and that's also very high, then maybe there's something that's confounding it. However, if all three of the vascular tests are high, then it's pretty much vascular. And even more conclusive, if that SED rate, if that musculoskeletal inflammation test is low or normal, then you pretty much have a cardiovascular event. And that matched with history, and then God forbid if they have comorbidities like high blood pressure, high cholesterol, they're a smoker, diabetes, then it's a full court press to try to alleviate that risk, that factor. Good question.
Uh, Well, I do have another question from the audience, Dr. Phillip. They're asking about blood clots, and how would they be aware of them having blood clots, and if there's any symptoms that they should be more aware of, or what are your recommendations in reference to blood clots?
Yeah, so unfortunately, the only way to recognize a blood clot is to do an ultrasound. Most of the time, they occur in the lower extremity, in the calf muscle, so the back of the leg. So there are some companies that do proactive ultrasound tests to try to ask your primary care provider to order a test for you. That could be kind of hard um, because insurance isn't going to cover it just because you want it. But there are some screening companies out there that can do it just because you want it. So that's one test. And then kind of piggybacking a little bit onto what Angel was asking, there are an ultrasound of the heart. It's called an echocardiogram that can be done. There are also other imaging of the heart, like what's called an ultra fast CT that looks at the blood vessels of the heart and the calcium score, and that could tell you if you're at risk. Um, Also, if you have a very low calcium score, which means that pretty much your blood vessels are free of the typical atherosclerosis, like the calcium plaque buildup, if that's low, but you're having symptoms, then that really kind of points to more of an inflammatory response. And that's what the cardiac echo would pick up. Or sometimes they can do the best test is an MRA, which is a magnetic resonant angiogram to kind of look at the heart function, if you will, or a thallium test, a nuclear medicine test that can also look at heart function. So there's a variety of tests out there. They're not in mainstream medicine yet. And it's not until you're having symptoms that those tests will be kind of authorized and then paid for by insurance.
That's very interesting.
I know.
um, I I think being proactive is very crucial to get ahead of these things, but one step at a time, right?
Yeah.
So we do have another question for you. And that is, what are the symptoms of a blood clot?
So it's primarily pain in the back of the leg. So if you kind of squeeze your calf and you have pain in the back of your leg, that's disproportionate, which means that you squeeze both legs, and it's pretty darn rare to have a blood clot in both legs. So if you squeeze both legs and one leg is a lot more painful than the other, that could be an indication of a blood clot. If there is swelling, again, disproportionately. So if you take an old-fashioned cloth tape that you would use to measure your waist, if you measure at the ankle, at the widest part of your leg, of your calf, and then right below the knee, if you take those measurements and those are bigger than the other leg, then that's also an indication. And then the final thing, and this goes back to pain, is that the pain is just gnawing and
Mm,
unrelenting. In other words, you can't find a comfort spot. You take some medication, it doesn't get better. Walking always makes it worse. Um, and those are kind of the hallmarks. The last thing, and this is a emergent, which means that you should be in an emergency room, is if your leg starts getting purple or blue, that means there's so much swelling that the arteries are being compromised and the arteries are being compressed. And now you're getting decreased blood flow to the extremity.
wow.
Wow.
So you hear that, ladies and gentlemen? If you have these symptoms, go get seen ASAP.
Yeah, yeah. I mean, the caveat to all this is, as both of you have brought up, is just know your body. And if you feel something, say something. In other words, go somewhere, get some help.
Exactly.
Absolutely. Absolutely. So this brings us into our next segment on, what can we do overall to, after we have the symptoms or before we are symptomatic, what can we do to help these this out?
Sure. So there are a variety of websites out there that I use as resources. These are medical organizations that have been around really since the inception of COVID, um, individual cardiologists that have been around since the inception of COVID. They all have a protocol of how to eradicate the spike protein. And all of it is oral supplementation. So there's some very easy things that can be done to help eradicate that. Um, and then you can kind of put all these things together. So and then of course, the caveat is talk to your primary care provider to make sure that there's no contraindications for you taking any of these things or any allergies to any of these things. But again, you can find this out there on the Ethernet if you just search how to get rid of spike protein. But you'll find out there um, nattokinase, curcumin, bromelain, and then anything to help out with reducing inflammation. So we have a wonderful product, which is called Xanthomist, which is a mangosteen-based product that helps out with reducing inflammation. Then we have another wonderful product that's glutathione-based called Glutamist, which helps to detox the liver, which helps good cells to replicate other good cells. So that's the glutamist. Then you need another immune boosting product, which is CBDA, which is our oil that helps out with, again, not only boosting the immune system, but also reducing inflammation. And then we have two products that are kind of a foundation to give the cells all the nutrients they need as they're going through this healing process. One of them is a multivitamin, and then the other is a specific immune boosting product that has all the superfruits in it to kind of round out, helping out the immune system to heal and kind of reboot, if you will. And that's what we're trying to do is we're trying to reboot the immune system. So one of the ways you do that is by reducing inflammation as much as you can, helping the cells replicate good, healthy cells as much as you can, and then give the cells the foundational ingredients, if you will, kind of like the building blocks, if you will, to help the cells to nourish them. And by doing all of that, then you can kind of give yourself a foundation, if you will.
This is really great stuff. So we have a question for you from the audience, and that is there some type of detox that you can do to help eradicate the spike protein?
There is, unfortunately, those are all invasive. And what I mean by that is you have to go into a clinic. So, for example, if you were to come into my clinic, we have a detoxing program that literally it's almost like dialysis, where we have a cannula or an IV in one arm. We have another cannula or an IV in another arm. And then we're pulling blood off, running it through a microfiltration system, running it through ultraviolet light, and running it through an ozone generator. And all that helps to kill viruses, um, fungi or fungus, yeast, bacteria, and abnormal substances that are in the body. And you literally there's a container and you can literally see all this stuff getting filtered off in that container. But unfortunately, you have to go to a clinic to get something like that done.
That is invasive. However, I believe it's well worth it. Is that
Mhm.
something insurance covers?
Sorry. Um, Unfortunately, insurance is not there yet. Um, I'm hearing through all of these medical organizations um, that there are lawsuits that are kind of bubbling up. And I think there may be something, and I literally just read it in a blog this morning, that there's kind of bubbling up a maybe kind of like a class action lawsuit that happened against the tobacco industry with smoking. So who knows? There may be something like that that kind of bubbles up. We'll see. But until then, um, it's just like anything else. You invest in the maintenance of your car, you change the oil, you rotate the tires, you put on new tires. So if you're going to maintain your car, what's more important, the vehicle or your body? So I think people should be investing in their bodies now um, before you can't, and it's too late. Like unfortunately your friend, I mean, which is so sad.
Yeah. So as you're speaking, I get to thinking about risk versus benefit
Mhm,
and informed consent,
mhm,
and just how much, like, yes, at the end of the day, we have to decide what's best for us, and we do what we can with what we know, right? That's all we can do. However, I believe that there has to be some level of responsibility for the people who's telling us, hey, get this for your health. and to help others.
Mhm.
Especially when we have deaths and we have people who are dealing with issues in the long run.
Mhm.
The long haulers is what they call it, right?
Right, right.
So yeah, I hope something comes of this because we need help. We do the best with what we can with what we know, and when we do it, we should have some sort of compensation, I believe. But um
You're absolutely correct. And I also had another phone call with a dear friend of mine who I went to medical school with, who is in Chicago, and his whole practice is around COVID, around vaccine injuries, and around long COVID, long haulers, whatever you want to call it. So we were comparing notes on how we can treat these people, because unfortunately, it's not a cookie cutter. So in other words, you step on a nail and there's a specific antibiotic you get for it. For this, it's not one size fits all because there are a variety of symptoms. I was just talking to a patient yesterday, and Angel, you brought up we should probably have a separate talk just about cancer, and the new term is called turbo cancer. um, I just had a phone call with a patient guest yesterday about prostate cancer. Healthy guy, all of a sudden he has prostate cancer, and what can be done for that. So, yeah, that's a whole other topic uh, of what can be done and how to help people.
absolutely. Jovi, do you have any questions, comments, concerns?
No, I totally agree, especially coming up with this topic. It's very concerning, and a lot of people have a lot of questions, you know? So I know that you've answered a lot of the questions that a lot of the audience were asking, Dr. Phillips. So it's concerning, and it's very very educational of what you're putting out there and telling us exactly what to do, you know? So that's the main thing. And giving people the options of what they should start doing to repair their bodies.
Yeah, I mean, if you do nothing else, and if you hear nothing else, at least start some type of baseline foundational um, vitamin and supplement regimen. At least help fuel the body's natural recovery. I mean, if if you got a car again, um, and if it needs premium fuel, you put in premium. You don't put in regular. You don't put in the cheap stuff. You give the vehicle what it needs. Same thing with the body. Give the body at least a baseline foundational kind of um, package that can help it, that can help boost it.
So you mentioned a few products earlier of things to help to reduce inflammation that will help with the spike proteins to eradicate it. Can
Mhm.
you tell us again what those products are and where we can find them from?
Sure. So the nattokinase, the bromelain, the curcumin, you can find at any big box, well, except for the nattokinase, sorry. Um, you should be able to find it at like maybe a big box health food store. You should be able to find all three. If not, you can just search online and you can find them at any big box shop online store. Um, and then as far as the foundational things, there's kind of two ways to get it. One is called the Vital for Life Foundational Pack, and you can get that through CTFO. And then the CBDA oil, you can also get that through CTFO. And I'm sure Alice, when she reposts this, will repost all the links on how to get there.
Awesome. Thank you guys so much for this amazing discussion. I've learned a lot. I've been taking notes. So definitely something worth looking into and to help out any way I can, because it is near and dear to my heart.
Mhm.
Having people around me having injuries seemingly after taking the vaccine. So I definitely want to do everything that I can to help support them and others. So, with that being said, any last words before we wrap up?
Any last words,
Ladies
Dr.
first.
Phillip? No,
Ladies first.
I think you came up with all these information and it's just very educational. That's the main thing, is being educated and having a concrete foundation, for your body. And like Angel said, yes, we need to start helping as many people as possible and get them educated as well. That's the main key.
Absolutely. I would just like to reiterate, if you feel something is off, ask questions, ask more questions, get multiple opinions, and create that foundation for yourself where you're being proactive about your health and not just reactive, because proactive is key. That's how you get healthy and how you stay healthy. So, yeah,
Yeah, so building off of that, invest in yourself. Because if you don't invest in yourself now, you're going to have to pay for it later on. And you're going to be forced to pay for it later on. So invest now, and it'll pay off much more dividends later on in increased quality of life, better health, better engagement with your family, um, just more joy. So invest now.
absolutely. Well, there you have it, guys. We are living well, the ultimate health journey with myself, Angel, Jovi, Dr. Zini, and our beloved co host who is not here with us, Alice. We hope you enjoyed this segment, and we look forward to seeing you next Wednesday at 8 p.m. Central Standard Time, talking all things health. Until next time, bye.
Bye.
That was fabulous. You did a great job, Angel.
Woo. Thank you.
My pleasure.